Hello everyone, today is June 18th and I wanted to update you as promised. I met with the medical oncologist and the plastic surgeon yesterday. So this is going to be my update on oral chemo, my second surgery, and just some things that I've discussed with them. Hi everyone, my name is Michelle. I started this channel to document my journey with stage 3 metastatic triple-negative breast cancer. I'm fighting my cancer from a holistic approach using both conventional standard of care and alternative therapies, as well as a carnivore ketovore diet, which has healed many other long-term health issues for myself. During the course of chemotherapy and immunotherapy, I also developed Central Adrenal Insufficiency, which they tell me is permanent. So, as I continue my journey, there's more story to tell. On this channel, I will share things about cancer treatments, adrenal insufficiency, carnivore, ketovore, and maybe some non-carnivore cooking recipes as well. Family, faith, philosophy, spiritual awakening, light work, non-toxic or clean products, and anything else I might find interesting. Thanks for following along on my journey, and please like, subscribe, and share if you find anything of value. Thanks so much. Okay, so I met with the medical oncologist. Actually, I met with the PA in that office, so I didn't actually meet with my oncologist, but I had sent him a note ahead of time so he kind of knew what side effects I had had on the Zeloda and my first round of Zeloda, and kind of questions I had, which we have some plans next week that are going to involve some walking, and I want to make sure that I am feeling as good as I can feel. So I had a question about maybe changing the schedule, and good news is that they said that's great, where I'm taking basically a few weeks off from the Zeloda so that I can get those summer plans done and not have to be on chemo during that time. And so we're gonna just take a couple of weeks off so that those things can happen without worrying about chemo. So again, the Zeloda side effects that I had, I had a few more days in my last video left in the cycle, and it was the first cycle of the Zeloda oral chemo. Capecitabine is the drug name, and I had some nausea. It was mild, mostly. It was a little bit of nausea every single day, but it never really got bad. Only, I want to say 3 times I needed to take Zofran, which was prescribed with it, so that I have that when I need it. But it wasn't too bad. I had some minor loose stools, but I never had diarrhea. I had tingling in my fingers and hands, and some swelling in my hands, and some swelling and burning in my feet or on the bottom of my feet, and no blistering or peeling or anything like that. So I would say that is the medical oncology PA did say that is the hand and foot thing, but it seems mild, at least so far, but that could get worse as we go on. So definitely something to watch and keep in mind as in future cycles. Fatigue, itchiness, the itchiness all over has gone away, not being on the Zeloda, so I do think that was caused by that. The hidradenitis, I ended up with seven of them, and they're not active. They're kind of continuing to calm down. So I don't know if I have all 7 bumps. I'll have to check when I take a shower later. But so I think in my video I had 3, but it had gone up to 7. I had 2, 4, 5, 6, 7. Yeah, I had 7 hidradenitis flares. So that definitely is affected, I think, by the Zeloda. And then the other thing I talked about was my negative mood. Like, I just felt like I was really grumpy and kind of feeling a little sorry for myself, and I was having a hard time kind of pulling out of that. And so the medical oncology PA talked about how that's really common at this stage of cancer treatment. I'm almost a year in. We're actually coming up on a year next week since I found my lump. And so in the beginning, when you're first diagnosed with something like breast cancer, any kind of cancer really, everything happens really quickly. You start treatments, you see lots of doctors, you get lots of diagnostic tests done, and there's always something to focus on. There's a task to focus on. This is the next thing, this is the next thing, this is the next thing. And so as you check those things off the boxes, we're getting into for a year, and everything isn't checked off the box yet. We're not yet on the other side, but everything is happening much slower now. And so up until now, for the first year, basically you're in survival mode. And this resonates with me very well because I'm a dog behavior person. I work with dogs with behavior problems, and I talk a lot about how when dogs are in survival mode, they're just, if we can just get them to focus on a task, we can stop a behavior from happening. And so that's what cancer treatment was. We first had, the PET scan and the MRIs and the biopsies and the staging, and then we started chemo right away, and it was chemo every single week for 12 weeks, and then it was every other week for another 8 weeks, and then the next thing was a month later the surgery, and then recovery from surgery, and then the radiation, which was every day for 6 weeks. And so I always had a task to focus on. Now, okay, you're going to be on this, you're going to take this Zeloda every day, but it's all really managed at home. I don't go into the office for this. I go in every 3 weeks basically for blood work. And so everything is happening much slower now, and my mind has the unfortunate likelihood of now sitting and processing everything that's been happening. And so now we go through the stages, where there's denial, and there's anger, and there's sadness, and there's anxiety about, okay, what comes next. And so that's kind of, she wanted to put that out there. And once she said that, it definitely resonated with me. It made sense to me why I'd be focusing more on the crap and that sucks. This whole thing sucks than I had been before. So on the other hand, I don't have that feeling of dread anymore, not being on the Zeloda. So I do think that it was enhanced or amplified perhaps by the medication. So I still think it's important. Don't just assume that it's a normal part of the process. And everybody wanted to tell me, oh, no wonder you feel sorry for yourself, look at what you've been through. And don't encourage me. Don't encourage that. Say, no, there's always a bright side, because I'm alive. I'm alive. I get to do things with my kids. We planted a garden, and there's vegetables I won't eat, but my son has 3 hot pepper plants, and he wants to make his own hot sauce. That's wonderful. What a wonderful thing that he wants to do. And so that's my nature, is to focus on the pleasant things. It's a really hot and humid day, and I could sit here and complain about the humidity, or I could say, wow, the sun is shining, I'm outside, it is a little breezy, let's focus on that breeze as it comes through. And that's my nature, and I feel more like myself and my ability to do that now that I've been off the Zeloda for about a week and a half. So I do think the medication plays into it, and it's definitely something I'm going to keep an eye on, and I'll keep you updated as the future cycles go through. I also last week met with the surgeon, and we will be planning the second surgery, which is just the symmetrical reconstruction. And that will be in October, in the fall, after kids go back to school, and there are no further summer plans, because we do have a few things that we want to do this summer as a family, and some of that's happening next week, and some is at the end of July with friends as well. So we've got fun things to do on our to-do list over the summer. What else? The physical therapist, I see her again tomorrow. Today I saw the acupuncturist and had my naturopath. We reviewed my supplements. I don't think I really changed anything since my last supplement update. I may have added a couple more things in. I don't know. I'll go through another supplement when I change it again. That's significant. I may have added one thing or taken one thing out, but nothing crazy different with the supplements. Did have acupuncture. We're working on that nerve that comes down the arm, or I should say from the lymph node area where I had surgery, and up down the arm goes to this spot right here. And so I can push on it here and it hurts in my armpit, or push on in the armpit and it hurts right there. The physical therapist, the massage therapist, and now my acupuncturist are all working on that, and it's better every day, and I'm doing my physical therapy exercises as well. So that's the stage of the game right now. End of June, so without my calendar in front of me, I think we are a month and a half out from radiation and almost 6 months out from chemo. And here we can see nothing's really changed since my last. It's pretty much the same. It's I can't do anything with it. If I try to do something with it, it ends up looking like that. That's the best I could do. So that's my hair. Again, not as much dandruff this week. If I go a few days without washing it, I could probably scratch up some dandruff, or some flakes, I should say. I don't know if it's really truly dandruff, but that was worse on the Zeloda as well. So that's my update. Have a wonderful sunny June, and we're coming up on July already. So we will talk soon.